Welcome to the office. Welcome to the office.
Thank you.
Okay, so we got some stuff to talk about today.
Yes.
You're here for your back,
Yes.
right? And you're here, you said you want to share with kind of what's been going on?
Yes.
Okay.
Well, I had an injury in 2015. A
Okay.
car accident. I was rear-ended. The lady must have been driving 70 miles an hour and no brake. We didn't hear no brakes. Since then, I've been having so much lower back pain, middle pain, and like my shoulders and my arms hurt.
Okay.
Then in 2018, someone took a wrong turn and hit me, and it hurt my side.
Okay.
And I kind of feel like that kind of hurt my knee. But it just brought me more pain to my back, to my lower back. And just recently my back just started popping and the pain is so bad.
Is it shooting down your legs?
On this side.
On the right side?
Yeah, to my
But
knee.
it's local mainly, right?
Yes.
And it's interfering with what?
Walking, going to the gym, cooking,
Okay.
doing the dishes,
Life.
shower, and just life with my husband.
And you have family?
Yes,
You're married?
yes.
And how many kids?
I have 5 kids.
God bless you, lady. That's
Thank you.
awesome. And they're with you?
Yeah, well,
Why
2
are
are
you
married.
tearing? Why are you tearing? What's up?
No.
Let me get you some tissue. Are you scared I'm going to do something?
No.
Oh.
I've been waiting to see you.
For how
a
long?
Time. Since I first saw your first video, I said it's him. He's the one that's going to help me.
Oh, well. Your family knows you're here?
My kids and my husband.
They know you're here, right?
Yeah, my husband who doesn't believe that you can help me.
Okay. And that's okay. Right?
Yes.
I'm not a religion. Okay? What we're going to do is this. So your number one reason you're here is your back.
Yes.
Your mid-back is hypermobile, it's popping a lot.
Yes.
Right? Is what you're telling me. And you're just trying to get some movement right
Yes.
now, right? And some better
Yes.
quality of life.
Yes.
Is that correct?
Yes.
Okay. So what I'd like to do is we're going to go over your x-rays.
Okay.
I want to explain what I see. Now, you said this injury you had is from 2015.
Yes.
Okay. I'll go over your x-rays, we'll examine you, we'll figure out where we're going to start today.
Okay.
Okay?
Thank you.
And then we'll show hubby good or bad, what it is.
Yes.
But let's get an answer today.
Okay.
Fair enough?
Yes. Thank you.
Let's get started.
Thank you.
You're here, okay? Let's do this. All right, so this is a picture in time. This is your full spine x-ray. You've heard me say, oh, there's 24 bones in the spine, 23 discs in between, this is a 24-story building I want you to think of, and this is the foundation of the building.
Yes.
Yes? Okay. This is your side profile. In your case, I'm going to go over your side profile first. And the first thing is your posture. This is L5, and we run it straight up, and it should bisect through here. And what it shows us is you have anterior carriage of the neck. Your neck is too far in front.
Mm-hmm.
And there is a little bit of a reverse curve. So let's try it this way. Now, what's most important here for us to understand is let's look at the low back and see what happened. You said your injury was in 2015, right?
Yes.
When I look at the condition of this spine, this is your L5 disc here. This is your tailbone, right?
Yes.
So this is the back of your sacrum. This is the back of your tailbone. Now you were told that your L5, all this is forward, correct?
Yes.
It's not. Your sacrum is posterior. Your L5 is in line with your 4, your 3, and your 2. If this was a L5 spondy, this L5 would be anterior to the sacrum and L4.
Oh.
You have a base posterior sacrum. Okay?
Okay.
That's what you have. That's not my opinion. That's what you have. That's what it
Okay.
is. Actually, it is my opinion. Sorry. Now, if we go closer, the shape of this disc tells me this is 25, 30 years old. And you're telling me 2015, so I'm not really buying the 2015, okay?
Okay.
2015 accident triggered something that was already there. It probably made it a little worse.
Okay.
That's okay, but I'm letting you know this isn't from 2015, all of this.
Okay.
Okay. So the first part is this. You have a little bit of disc there. We need to stop this. Okay? We need to get this sacrum underneath. I don't know how you're going to respond till we start. Okay? We have to see how you're going to respond.
Okay.
Now, that's L5. Your L4 is decent. Your L3 is decent. Your other discs are decent, man. I would expect this to be worse. These are good. These are good. These are all good. This is old compression. This is in the mid-back. This is your digestion area.
Okay. Is that where I have pain?
In the middle of your back, man?
Yeah.
That's around the area you're complaining of. Is that the cause of it? That's not what I'm saying.
Okay.
I'm just pointing out the stuff that I see
Okay.
right now. That's all. So what this tells me, you've had old compression injuries, whether it was the work, heavy lifting, heavy work, or if it's related to your lifestyle.
Mm-hmm.
Okay? So that doesn't matter either or. I'm just pointing it out. You can see that they're kind of bent in the front. They're rounded in the front. It means you're putting a lot of compression on that. And the reason why you're putting a lot of compression, you got no curve in your spine, man. You've heard me talk in the videos, right? When you
Yes.
curve, this is you got like, it goes like this and it's straight all the way up. So guess what's taking up all the force, all the weight? Your low back.
Yeah.
And your sacrum is behind your L5, so guess what? It hurts.
Yeah.
I get it. Sitting hurts after a while. Standing hurts.
Standing hurts more.
Lying down is probably your best bet.
Yeah.
Now, this is an exception to where I have talked about on other videos. You may benefit, I don't know yet until we'll test it. We're going to change some sleeping positions with you. So it's not typically what I've said on previous videos in your case. We'll talk about it more when we get into more management.
Okay.
Okay? Do you understand this L5, ma'am?
Yes.
Okay, that's your L5 disc. It's a base posterior sacrum. We got to push sacrum back forward.
Okay.
This is but here's the other part of it. This is your foundation from this side. We have a little bit of internal rotation of the pelvis on the left.
Mm-hmm.
We have a slightly dropped on the left side, but this is the big thing. You got 15 millimeters of rotation of your sacrum. So this is what's happening. Your sacrum has come back and it's turned on the left.
Oh.
So the whole picture is this. Look, on that picture, this is L5, right?
Yeah.
It's gone back on the left like this.
Okay.
And that's your issue now. It's a base posterior or a rotated sacrum, 15 millimeters on the left side.
Okay.
Okay? That's what I
Yeah.
see. Now, let's go back to this x-ray and continue. Digestion is definitely an issue. I don't even see the Megan blessing on you. So we need to add those acidifiers today.
Mm-hmm.
We need to add the acidification. I'm not telling you to change your food. We'll add the acidifiers. Let's get the body digesting the food that you are eating.
Okay.
And don't be surprised what's going to happen.
Okay.
Okay? Questions so far?
No.
Does that make sense what I'm
Yes.
saying, ma'am?
Yes.
Your hips are a little bit, we will need, you brought me an MRI of your spine. Have you had any imaging of your hips?
I did, and that was in 2003. And I can see by my hips that having the twins made my the doctor said, wow, because you can tell that this was really wide open.
That was then, though. It's not
Yeah.
wide open now.
Okay.
I want to see the hips because there's a lot of signal distortion here. Okay? I should see a black line in through here. Clear. I can see a little bit of a line, but it's pretty white, and I just want to make sure it's not signal distortion. So it's nothing I need to deal with at the moment.
Okay.
But we do need an updated image of those hips.
Okay.
Separate, okay? And if you have anything historically, I'd like to look at it.
Okay, I'll look.
Okay. And now the knees. Mm-hmm. Bueno.
Bueno?
Bueno. No, bueno. But yeah, better than you think, ma'am. You feel it more in your left knee, correct?
Yes.
Yeah.
No, actually,
Right knee?
my left knee was injured at work, but my right knee is the one that's been hurting for the past year and a half. I have like pain, numbness, I feel like it pops every once in a while.
Okay.
So I kind of limp on my right.
What I see is your right is compensating.
Okay, from
your
the left?
Yes. Left sacrum, left knee.
Okay.
Right side is these line up pretty decent.
So from the pain that I've had in here, now it's
switched.
Okay.
Switched. You see this number is bigger, this number is smaller.
Yes.
You see the separation of these two versus
Yes.
those two. This is more misaligned than this side.
Okay.
Okay? But this is coming from sacrum.
Okay.
Started with the sacrum. Number one, I wouldn't touch the right knee today at all.
Okay.
Okay, where I would start with you is your foundation, of course,
Yes.
and anything else I find. We will then evaluate the knee after 2 adjustments. I got to give your body a chance.
Okay.
Does that make sense?
Yes.
Okay. Cool. The left was worn out first. The
Okay.
right has been compensating.
Okay.
Okay. Let's look at the neck. Okay. And what I'm looking for in the neck is any compensation. Nope. So in flexion, they all move forward. It's not coming from your neck. There may be something in your upper cervical here. We'll
Yeah.
deal with it. So we have the penthouse, the basement, and the digestion area in between, okay? But the big thing is, I want to see this little black hole right here should be nice and dark. You can barely see this circle. It should be this big.
Okay.
And so that's part of the digestion issues, okay? That you're not absorbing, assimilating your foods, because you're not breaking. So it don't matter what you're taking. It doesn't matter what pills, what supplements, this. You need to get acidification first.
Okay.
Once you get acidification, then you can get all your other stuff in,
Okay.
and the body will absorb it.
Okay.
So I'm not going to tell you to stop your other stuff. If you want to, maybe for a week would be good. That's up to you to decide. You're not taking meds, but your supplements.
Yeah, just supplements.
Yeah. And I would like to see what the body can do with the adjustment and the acidification, and you'll report back to us and tell us the difference.
Okay.
Okay?
Sounds good.
You ready for me?
Yes.
Let's get started. You ready, ma'am?
Yes.
All right. You a little nervous, you said?
Yes.
You're going to be okay?
Yes.
I will ask your permission before I do anything, okay?
Yes.
All right, starting at the base. And the first thing we're getting is 20 points, top left, okay? Penthouse. And she's got it all the way down the left. Oh, guess what? I think she's got cord pressure. Guess what, ma'am? You got cord pressure.
And what is?
I'm going to explain to you in just a minute, okay? Aquí. She has classic cord pressure. So, what that is, if you've watched my videos, I talk about the cord pressure coming from the upper cervical. And the needle on the meter is sticking on the left side the whole way down. Put your fingers in there, please. 2, 3 fingers. That represents your spinal cord.
Yes.
If it's doing this, what's it doing to your fingers?
It's kind of like moving on the left side.
Pinching, yeah?
Yeah.
Compressing.
Yeah.
Okay. You can put 3 fingers.
Yeah.
Be snug. Now you feel?
A little, yeah.
Okay, so it goes up and turns.
Okay, yeah, I feel it.
So the point I'm making here is you have cord pressure up here. It's affecting the cord all the way down,
Okay.
which is why the needle is sticking to the left side.
Okay.
So I need to fix the top, have you walk, and then recheck everything.
Okay.
Fair enough?
Yes.
Head down. Look to the left, look to the right. Look up to the left, up to the right. Look down, down to the left, down to the right. So it binds here on down into the left. That's the left atlas. Okay, let's go ahead and set it. Sit back for me, please. Hi. When was your last adjustment?
2018?
Yeah. You ready for me?
Yeah.
Okay. There it is. Left ear down. Gotcha. That wasn't so bad.
No.
I got in.
No.
That was full recon.
Yeah.
Sit up straight, please. Walk it off once and come back.
Oh, I feel a little dizzy.
Give it a second. You okay?
Yeah.
Have a seat. Let's recheck everything. That done did it. No more sticking to the left. Deep breathing, please. What's your hubby's name?
Hector.
Hector. Seriously? 5 points. Didn't change it. Meaning, this cleared up the entire
Really?
spine. Yes, ma'am. This is still there. So your issues to start with me are going to be the basement and the penthouse.
Okay.
We got the penthouse sorted out.
Uh-huh.
Now,
Oh my God.
actually, we're going to get the knee, we got to get the knee chest table now.
Yeah.
All right?
Yeah.
We got the knee chest table just in case.
Yes.
We're going to try and see if we can get you relaxed over there.
Okay.
Let's go face down on the gray table, please. 1 second. Step back for just a second. I want to make sure your stomach is okay and your pelvis here.
Okay.
Okay? You're going to go step forward straight away.
Okay.
Step on the black platform, please, and lean forward. You're fine. Perfect. Hold here. Hold where your hands are,
Yeah.
and let's lift you up. 1 second. Go up. There you go. Oh, that wasn't so bad. Shasha! I need help. Shasha! I'm giving Shasha a hard time. You ready?
Yeah.
So what did you have to convince Hector to get over here? Huh? What did you have to convince Hector to get over here?
I didn't. Oh.
I'm just nice and easy. We're just prepping, okay?
Yeah.
I'm going to pump it a few times. 5.
Oh.
All good, lady. Are you ready, ma'am?
Yeah.
Are you ready?
Yeah.
Let's start it and see what happens. That's a piece. I got you. Good. Good. Step away, Shasha. Please. That wasn't so bad. Did I sting you?
Yeah.
Let's see. Take your time, please. Hold my hand. Take your time, please. Okay. Hold the side, please. Hold the side. And just up and down with your knees, please. Okay. Just keep moving, okay, man? Just keep moving. Just keep moving. Keep moving. That's a good piece of it, but I got a lot more. Can I have you walk this way, please? Just get a tiny bit of movement, and then we'll continue. Okay, just tiny bit of movement.
Oh. My right knee hurts less.
Oh! Cool.
Yes.
Cool.
I was limping when I got here.
Right
I don't
knee.
feel like I'm limping.
Just keep walking now.
I still kind of feel dizzy.
Yeah. Can you grab her some water, Shasha?
Again?
Grab her some water.
goodness. A whole year of right pain on my knee.
What happened?
It's almost gone.
What?
Yes.
What? Oh, Hector.
Oh, it feels so good. I can walk flat. I kind of walk with like my leg up a little.
Have some more water, please.
Feels good.
I was gonna put you on the knee chest table. I'm not. Okay?
Yeah.
Because of the knee, let the knee heal
Yeah.
up. Next visit we'll go on there. I want to get a tiny bit more on this
Okay.
table here. Okay, just a tiny bit. And let's see what you'll give me. Let's see what you gonna give me some
Oh
more?
my gosh, my knee feels better.
Feels better?
Yeah. Okay.
Poquito más. Okay?
Yeah.
Poquito más. Poquito más. Ay, 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 ay. Bueno,
Yeah.
ready?
Yeah.
Okay. Shasha. We gotta bring that sacrum underneath, just like that. Gotcha. Hi. Step away, please, Shasha. Thank you. Caramba. A little bit less, right?
Yeah.
Take your time. Hold my hand, please. Hold my hand. Take your time. No, step to the side. Step to the side.
I cannot.
That's okay. I got you. I got you. Hold there. Oh, Maria. Doing okay there?
Yeah.
Want to walk once and come back and have a seat, please?
Yes.
Or walk a few times. It's okay. Make sure you're good. Less dizzy?
Yes.
Less pain in the knee?
Yes.
We didn't touch the knee though.
I know.
Oh, but you have to treat it.
And I was like that for a whole year and a half.
And all you needed was a sacrum push.
I think so. So, well, even turning does not hurt me. Like when I turn this way, my knee would hurt. Yeah.
Have a seat now. You are clear in the neck, madam.
Thank you.
I thought I was going to be working on your stomach button here, but we did it through the atlas, the parasympathetic. Señora, no nada. Guess what? You're clear.
Thank you.
Back slowly, check it out. What? That's your tailbone
Oh,
now.
wow.
Check it out. I didn't fix it all, but
I couldn't even do this. My kids have to lift me.
now, look at that. Back more, I got you. Go, 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 go! Can I continue tuning up a few things?
Yes.
Okay. Ears. Shoulders. Let me do the work. Down, down, there. Up, down. That's it. On your back, ma'am, I'm going to work on your ankles. Let me put paper there. Raise your right leg. And down. Raise your left leg. And down. Relax there. Bend your knee. Bend your knee. Duele?
No.
No pain.
No.
What'd you think?
Good.
Come on up. 1, 2, 3. Awesome.
I couldn't do that in a long time.
Now, the buff and
That
polish.
was like the easiest help. My kids had to pull me.
Really?
Yes, I couldn't even get myself up.
Huh. Okay. All right. Let's do the buff and polish. This is to break up scar tissue. Walk it out. Oh, senora. 5 kids, bless your heart. You working, or you were staying home taking care of the kids?
I'm a student, so I do school from home.
No, I'm talking about since the kids were born.
No, I work and take care of my kids too,
cool.
yeah. And my grandkids,
How many grandkids?
3.
So now you can play with them, okay?
Yes.
All right. Squeeze my hand. Squeeze. Squeeze. Yeah, squeeze. Ah, squeeze. Elbow. Relax there. Relax the hand. Breathe. Breathe. Don't fight me. Come on.
I am?
You're fighting me a little bit. Receive. That's it.
Oh.
Questions?
Can I come back?
You can't come back. This is your first visit, okay, ma'am?
Thank you, doctor.
So what I'll do is Shasha's going to book you 3 more visits over the next 2 weeks.
Yes.
This is for us to figure out kind of how you're going to respond. We know there's a pretty intense BP sacrum, base posterior sacrum.
Mm-hmm.
We're seeing how you're going to respond and how the frequency of the care is going to be.
Okay.
I'm not fixing within 4 visits. I'm being very clear.
Yes.
To get you pain relief, and then we need to figure out kind of what our game plan will be.
Okay.
Fair enough?
Thank you. Yes.
Welcome to the office.
Thank you.
You got it. Hi, Maria.
Hello.
Welcome back.
Thank you.
So we had one adjustment.
Yes. Only
What
one.
happened?
Well, when I left your building,
What did you come for? Over.
I had pain on my lower back.
Okay.
I thought that I had like one of my lumbars pushed in.
Okay.
So the pain was really bad and the pain burned so much. I couldn't get up in the mornings.
That was the
So-
main reason you came.
Yeah, so my kids used to pull me up and they started complaining that their arms hurt. So I said, okay, I need to lose some weight so they don't have to go through that.
Okay.
But then my pain started going up higher.
Okay.
My shoulders would hurt and my arms were starting to like hurt. So when I drive, my arms hurt. And so, and then my knee, this knee, it was so hard for me to get in the truck because I had to lift myself with the side. So this knee was always in pain or it felt numb. But, so that's what I came for.
Okay.
And when you adjusted my neck right away, the pain went away and I can walk better. I could put my foot right on the ground.
And I adjusted your seat too.
That's
Up
it.
top and the
Yeah.
neck. And then we did a couple other things,
Yeah.
right? So with what's changed since the first adjustment? And it's been about a week.
Yes.
Okay.
So I can go down the stairs and up the stairs without holding onto the bars, the handles from the
Which
side
you
of
weren't able to do
which
before.
I couldn't do before. I had to pull
For
myself
how
up
long?
um,
A year?
for like a year and a half because of my knee. I couldn't go up the stairs without holding and pulling myself.
Okay.
But going down since 2015, I couldn't go down one step at a time. I had to go one at a time.
A little shuffle. You were shuffling
yeah,
your feet.
uh-huh.
And now?
Now I can go up and down
Every
the stairs.
day?
Yes.
All right. So
But when I go to the gym, I was only able to stay on the treadmill on the line for 5 minutes I'll push myself to 10.
before.
Before.
Now?
15 to 20.
All right.
Yeah.
Nice. Very good.
Yeah, and I could do more crunches.
I don't want you doing crunches.
Well, I was doing 5 at a time. Three sets of 5. And I went to the gym after and I did 10.
I'd rather you not do crunches
Okay.
right now, please.
Okay.
No crunches. You can throw your sacrum out that way with what we're
Okay.
doing. 'Cause
Okay.
The main thing we're working on is that tailbone.
Yeah.
Right? Please.
Yeah.
Lots of movement is great.
Yes.
Once you can start walking backwards on the treadmill, I'd like you to start that as well. Pedaling backwards also you can do at the gym. Okay, just to get that movement. It's a great rehab for the knee.
And I lost 5 pounds.
Very cool.
Then the last week.
Just by moving.
Yeah.
Pretty awesome.
Yeah, because I couldn't move a lot.
Cool.
A lot. It was so limited that what I could do.
Awesome.
Yeah, so I can't even run.
You're not
No,
running.
well, like like from here to there, like if my grandson runs and he's gonna grab something, I'll run to him and grab him.
Okay, so
like little. I couldn't even do that.
Those are emergency situations.
Yeah, I couldn't do that at all.
Okay. Shall we continue?
Yes.
All right. So we worked on your C2, your T9, and your S1 sacrum. Let's run the meter on the back. Let's see what we find today, and let us continue. You know, you shared in the first visit, right?
Yes.
That people were saying, you know, this and that about your condition.
Yes.
And, you know, it's okay, you need to lose this much weight. That's why you have pain. Correct?
Yes.
I just want to be a little real
Yes.
right now. And, okay, maybe you can lose a little bit. Sure, we all can.
Yes.
But the thing was, you had pressure. You had nerve pressure causing your issue.
Yes.
And you were able to move. Okay, and okay, sure, you lost 5 pounds. Even if you didn't lose 5 pounds, I'm okay. I'm just happy you were able to move up and down the stairs.
Yes.
And you didn't need to ask for help.
Yes.
Correct?
Yes.
That means more to me than even the 5 pounds.
And when I wake up, I can get up by myself.
Awesome. So you have some more independence.
Yes.
T9 is clear. C2 is there. We will continue on C2. T9 is clear. We don't need to mess with that. I do need to bring these down just a bit, please, dear. And we have 5 points down low. We're going to continue on sacrum. We're going to continue on C2. All the way back, please. I'm being a little funny, but look at that, dude. Nice.
Yeah, I couldn't do that before.
Nice. Got it. Bueno.
Okay.
We're going to continue there. Scoot forward, please. Scoot back for me. And let's check the neck. And we were on that high-low table, correct?
Yes.
Yeah. Head down, please. Head down. Look down. Seven, 6, 5, 4, 3, 2, 1. And the reason we check extension first, especially when we're looking at the way a vertebrae will misalign, and I'm speaking specifically of C2 to C7 for right now, not C1 or occiput. The primary movement, or the first way it's going to misalign, is back posterior. When it goes back posterior, it's going to be a little stuck, or it's not going to move as well. Then you check lateral bending one side to the other. So when we're doing this, we're a little stuck at C2 on that's the left. I'll let you're guarding a little bit. Let it just fall left. Let it fall to the left. Now see, this is what's misleading. If I just do this, it looks like she's moving, but she's compensating. She's not moving at C2, or I'm not assessing C2, I'm assessing global cervical lateral flexion. So right about there, you feel that, ma'am?
Yes.
Okay, that's C2 on the left. Now let's go to the right side. Same thing.
Yes.
Correct?
Yeah.
More tender when I push to the right or the left? They're both about
the same.
They're both about the same. Okay, let's go to the x-ray and see the listing on C2. Let me see what we're dealing with. We have a PRI-C2. C2 PRI, which means the vertebrae is doing this. C2 PRI, this is your C2, that's that big bump on the back. Yeah. It's gone back, P. R to the right. I means the spinous is inferior to the wedge, which is on the left. So the disc is wedged on the left, it's turned to the right. So we need to put it in the exact opposite direction.
Okay.
Yeah? I don't know that putting someone on their back and twisting it is going to correct it, but
Okay.
it will make some sound.
Yeah.
Okay? Going prone is probably the second best option.
Okay.
So either we do it in the chair or we go prone. The pulls and the lifts and all that, I'm not going to get into the mechanics of that. I'll let you guys figure it out. C2. Nice and easy there. So I'm getting to the spinous of C2, which is there. We're going slightly off to the lamina, and I'm tucking that chin. We need to, if it's a PRI, that means the spinous is right. We're going to turn the head slowly so the spinous is center. Bring the elbow down and set. Perfect. Beautiful. Ha! Hi. Stand up and walk it off, please. And that's the set, right? It's one nice clean plunk. That's the set of the vertebrae. That's not cracking bones. That's not even adjusting bones. That's setting bones. That's what we like to talk about in the Gonstead work. And there's a lot of Gonstead doctors out there that set bones, guys. A lot of them. You just got to find them. Keep walking, please.
Yes.
Right?
Yeah.
You ready for some more?
Yeah.
Face down, please. Relax there.
Oh.
Gotcha.
Oh.
Nice. Zyklon. Zyklon. Zehupensaka. Nice. Step away from the vehicle, ma'am. Hold my hand. Step to the side. Take your time. Take your time. Take a minute. Take a minute.
Oh, that was a loud one.
Take a minute. That was deep.
Yeah.
But it didn't crack. It cloned. Right?
Yeah.
It was a clone.
Yeah.
Walk it. Walk it.
Oh, that feels so good.
Sick clone. We didn't touch your knee.
No.
I don't even think we're touching your knee today.
No.
Don't worry.
And my knee feels good.
Yeah. First, let me check on the meter. C2 is clear. Let me check the movement. You'll tell me the difference. Head down, please. So first is, let's check this way. Oh, yeah.
Yeah. Uh-huh.
So the P motion, the posterior motion is good now, yes?
Yes. So when you were doing that the first time, I felt like a little bit discomfort.
Now, to the right, left,
No,
to
nothing.
the right. Now, there's still some muscle tightness there, right?
Yeah.
I'm not trying to loosen up a muscle. Nice and easy there. All clear there. Now let's check the low back. Hi. Back towards me, please. Mira. All the way back, don't be scared. I got you. All the way back, don't be scared. Good.
Good.
Bueno?
Yes. Yes.
Alright, let's continue. Ears. Shoulders. Drop it down. Drop it down. That's it. On your back, please, here. Ankle time. Raise your right leg. Hold it there. Does that hurt your back?
Nope.
Bend your knee bring your knee to your chest the best you can. Does that hurt your knee?
No, I just feel like a little bit discomfort on the side.
Tightness or a sharp pain?
No, tightness.
Okay, straighten it out and down. Left leg up. Hold. You ready to stop guarding yourself now?
That one's fine.
No, you ready to stop guarding?
Oh, I am?
Drop it down. There you go. All right, madame, sit up for me and turn. Let's do a buff and polish. Let's buff it out, then we walk it out. Good stuff, lady. That's what I'm saying.
Nice.
Nice.
Very nice.
Continue your movements, okay? Let's not overcomplicate it. Stand up, please. Check the hands. Come over here, please. Squeeze. Squeeze. Bueno. Squeeze. Maybe a tiny bit. Wrist is okay to adjust?
Yeah.
Yeah.
I still, this is my normal handshake.
It's good.
Tight. It's not, I never just like, you know, and.
Questions for me for today. This is visit 2.
No, I'm just happy
You're happy?
that I'm here. Thank you so much.
You're welcome, my dear.
Yeah.
We're going to follow up. I'll give you another week.
Okay,
This
yes.
isn't about me trying to see you 3-4 times a week. And this is getting the pressure off the nerve and
Yes.
you getting your movement.
Yes.
Right?
Yes.
Walk it out. Ice
And
it
as
out.
long as I feel good about coming, I will keep coming if you let me, because it's helped me a lot in just 1 week. A lot.
Well, we asked for 4 visits to figure out the case,
Yeah,
right? And
yeah.
then from there we can make other decisions.
Okay.
At the same time, people should want to be here. I don't want people here who don't want to
Yeah.
be here, and we're not trying to fight this, right?
The thing that I forgot to tell you was that every morning when I used to wake up, because of my pain, I had to it literally be like this for like 2 or 3 hours. Not anymore.
Really?
Yes, for the past, since 2015, since the car accident.
Wow.
And it was always like, you know, I had to lean on the wall, like where the door is,
Yeah.
and hold on tight until I can stand straight and then be able to walk. And I don't do that anymore.
You're not taking more painkillers, right?
None.
Anti-inflammatories?
Nothing. Thank you.
You're welcome.
Because I had no more pain.
And ice is your best friend.
Yes, yes.
Okay.
Thank you so much.
You take care, my dear. I'll see you next
Thank you.
week. Bye.
Thank you.